Hello, hey, this is Brian Askins with Secure Insurance Group. Hope everyone's having a great day. This morning we're going to kind of walk through just the basics of Medicare, and I'll email you out some information following this phone call that could be helpful to you when you're visiting with Medicare clients. Again, this morning I'm going to walk through the basics of Medicare. At any point in time that you have questions, don't hesitate to stop me and ask me questions. Again, this time is always for you to just learn a little bit more about the products and services you're able to offer. So the first thing we're going to talk about exposures, or enrolling in Medicare, and we're going to talk about the exposures of Medicare, and that's the 2 points we'll get to today. We won't have time to get to the Medicare savings programs or the Medicare choices, but we will get to the first two today. So let's just talk about original Medicare. Original Medicare is when a person has the red, white, and blue card. So people, 99.9% of all Americans are eligible for Medicare in some form or fashion. And so are you eligible? And so if you or your spouse must have worked a minimum of 10 years, which is 40 quarters, according to Medicare guidelines. That's the most common way people become eligible for Medicare is if they work 10 years. There's other ways to also become eligible for Medicare, and it's based on income or disability, things of that nature. But for our sake today, we'll talk about the most common way, again, is the 10 years, 40 quarters. Now, the qualifying events of when a person becomes eligible for Medicare is the most common way is obviously turning 65. So when a person turns 65 years of age, they become eligible for Medicare. Now, there's a lot of confusion going on a little bit because Social Security has went to the full retirement age for people today is age 66. And then, down the line, it's age 67, and they keep extending out the full retirement age. But that has nothing to do with Medicare. So a person cannot be on Social Security and still be on Medicare. So, a person may have taken Social Security at 62, or they may take it at 70, or anything in between. But that has nothing to do with Medicare. Medicare is age 65, unless one of the other qualifying events, which I'm going to discuss. So turning 65 is the most common. Now, the second one is going on disability. So if you know someone who's on Social Security disability, after 2 years of being on Social Security disability, they become eligible for Medicare and start receiving Part B Medicare. And then, now more and more people are working past age 65 than ever before. So coming off of group coverage, which is working past 65, because people are working, past 65 more than ever before, like I mentioned. So let's just say they worked to 66, 67, whatever age, and then they decide to come off that group insurance at that time. Then they would take Medicare Part B at that time. And then the unfortunate one, which hopefully doesn't happen to anyone on this call or any of your clients, is end-stage renal disease. You'd qualify for Medicare if you were ever diagnosed with end-stage renal disease. So now, this right here is enrolling in Medicare is very, very simple, and I'm actually going to email this page out to you to where it shows exactly where a person goes in order to enroll in Medicare. And there's a Medicare hotline number, which is just 1-800-MEDICARE, and the Social Security hotline number, and it's just 1-800-772-1213. Now, if you call Medicare, it takes about 5 or 10 minutes to get through typically. They're pretty quick. If you call Social Security, it's going to be 55 minutes to an hour typically. And so it's much easier to call Medicare than it is Social Security. But for a person to enroll, it's real easy for them to just enroll online. So now, so if you're enrolling in Medicare, if you're on Social Security, you will automatically be enrolled. If you're not on Social Security, you will have to actively enroll yourself. So enrolling is easy. You can just go to the Social Security website and you can enroll in about 10 minutes. And again, I'll email you out the direct link to enroll directly into Social Security or into Medicare from the Social Security website. Now, if a person enrolling in Medicare, again, is really simple. It takes a person 10 minutes, and you can help your clients enroll. I've helped hundreds enroll into Medicare. But your initial enrollment period is 3 months before your birth month, and 3 months after your birth month. That's the initial enrollment period. And there's some special enrollment periods if you choose to enroll later on and so forth, but that's the initial. And so the 3 months before, so let's just say a person they turn 65 October the 5th. And so their Medicare is going to go into effect on October the 1st, and so they could have enrolled in Medicare on July the 1st. Now, they can enroll in July the 1st. The Medicare would not go into effect until October 1st, but they can enroll, if they had to enroll themselves, they can enroll as early as 3 months prior. Now, if they're on Social Security, they will automatically be enrolled, which just simply means that they're going to, around the 1st of July, Medicare is going to print their cards and mail it out to them, so they should get their cards about the middle of July. So individuals that are turning 65 on October 1st are probably already have their cards or will be getting their cards any day if they're already on Social Security. Now, so what if I plan on continuing to work past 65 and not take Part B? So let's talk just a few minutes about individuals who are going to they're going to continue to work past 65. Now, Medicare Part A, they'll want to take it because it's premium free. Okay, and we'll talk about that here in a minute, but it's premium free for most individuals. And so what if I continue to work past 65 and not take Part B? Some workers will enroll in Part A because Part A is premium free and not Part B. The typical premium for Part B is $134 monthly. That's the typical premium, where the employee health plan is still in force. So check with your employer regarding this option. So, and I've got out here in the parentheses, I've got 20 employees because I want to make sure I pointed something out to you. If a person works for a place that has more than 20 employees, they will not receive the Part B penalty if they decide not to take Part B. As long as they're keeping group insurance, and we'll talk about that here in two more slides here. If they're below 20, if they work for an employer below 20 employees, and then they would have to take out Part B in order to avoid the Part B penalty. Which again, we'll talk about the Part B penalty here in 2 slides. And so let's just say that they work past 65 and they get their group health insurance, and then their employment ends at the age of 67. Say they retire, and so at that time they'll want to activate Part B. Now, at that point, they have a 6-month guaranteed issue window to sign up for any available Medicare plans once activating their Part B. So, for example, like a Medicare supplement or something of that, and I'll just use Medicare supplement as our example here. So, once obviously they want to sign up, have the dates coordinate for when their group health insurance is ending. So that's if they're going to take Part A but not B. So if they did this right here, their group insurance would the Medicare be primary, the Medicare Part A be primary, the group insurance be secondary, and in most situations that would be the case, and to where the employer is going to want them to take out Part A because, again, it's premium free, and that's going to eliminate a lot of the expenses toward the group health insurance. Now, the employer probably want them to take out Part B too, just because Part B, or may want them to take out Part B, just because Part B is going to be the medical coverage of the plan. And we'll talk great detail about A and B here in a minute. But so what if I continue to work past 65 and take Part B? If you decide to take Medicare Parts A and B and keep your group insurance, when you come off the group plan, you have a 63-day guaranteed issue window if you decide to sign up for a Medicare supplement, as an example. There are some situations where Parts A and B are in force and your employer's health plan pays the remainder of the cost. And that's where I talked about your group insurance Medicare would be primary, group insurance would be secondary in most situations. And between the two, that person would have 100% coverage. Now, 9 times out of 10, or at least 8 times out of 10, going on Medicare is going to be better than them staying on their group insurance just because of the high cost of the premiums for group insurance. Now, most of the time, again, Medicare is going to be a lot less expensive than the group health insurance premiums to that individual. But now, sometimes what you're going to run into, and I actually ran into this twice last week, to where the group insurance the Medicare was obviously much better than the group insurance for the Medicare person, but they were 2 guys, both turning 65, but both were going to work till they were 66 or 67. But both had their spouse on there, which was 4 or 5 years younger than them. So their spouse was 61 or 62, and in the low 60s. And so the problem is that they wanted to keep the group insurance, not because it was a better deal for them, but because their wife was on the group insurance. And unfortunately, through the healthcare exchange program, there's just not a lot of great options unless the person has very low income, and sometimes there's good options, but most of the time the health insurance options that we have for under age 65 is just not real great, and they're very costly in most situations. So these individuals were going to keep the group insurance, and so I wasn't able to write a Medicare plan at this, now, but I'll get them in a year or two whenever they do decide to come off the group insurance. So, which will be whenever their spouses, when they retire or their spouses turn 65, one of the two become eligible for Medicare themselves. So, here's the most important slide for those who are thinking about continuing to work past 65 or keeping the group insurance past 65. And this is there's a lot of confusion on this. I want to make sure that you understand this so you can get the proper information out there. If an individual is no longer employed and decides not to activate Part B, even though they have group health insurance coverage, they still will receive a Part B premium penalty. The Part B premium penalty is a permanent penalty, and it's 10% for each 12-month period that they were eligible for Part B. So let me give you a couple of examples. We had an agent here in our office that was working with a federal employee, and this federal employee was 67 years of age, and she retired from her federal job when she turned 62. She retired, but she kept her federal employee insurance until 67. So when she turned 67, at that time, she enrolled in Medicare Part B, and so she and her husband was 69 at the time, and so he also enrolled in Medicare Part B. They only had Medicare Part A, but they never worried about enrolling in Medicare Part B because they had the group insurance, and they thought that because they had group insurance, they would not be subject to the Part B penalty because that's what another insurance agent told them. Well, that's false, because in order to avoid the Part B penalty, they both, if she would have continued to work and be employed by the place that was offering her group insurance, then him or her, neither one, would have been subject to the Part B penalty. But that she was not actively employed. She was no longer employed, and she did not activate Part B. Even though she had group insurance, she still received the Part B penalty. Her Part B penalty is 20%, his is 40%, and that's a permanent lifetime penalty. The Part B premium is $134 monthly in 2018. The normal one, the typical one, is $134, and so she's going to pay $134 plus 20%. He's going to pay $134 plus 40%, and then next year, if the Part B premium goes up to $140, they'll always pay 20% and 40% above what the Part B premium is, because it's a permanent lifetime penalty. They were misinformed, but unfortunately, they're always going to be subject to that penalty. So I just want to make sure you understand that, so you can give your clients the proper information. They have to be actively employed and receiving the group insurance from their employer. And they got to have more than 20 employees. So there's a few stipulations there. Now, everyone receives new cards. In the past, the Medicare cards have always had the individual Social Security number on there, and it was typically a Social Security number with an A at the end if they were claiming on themselves, which simply means that they had the 10 work years. It had a B on the end if they were claiming on a spouse that had the 10 work years, and they didn't have the 10 work years. It could be a D at the end if they were claiming on a deceased spouse. Now, one thing is different about Medicare than Social Security, and I'll kind of point this out to you. Like, you can have a spouse that only had 10 work years and only made $20,000 a year for 10 years, and let's just say their spouse made $200,000 a year for the last 40 years. They'll still claim on themselves for Medicare, because once you have the 10 qualifying years, all of your Medicare benefits are the same. You don't get any extra benefits because you made more money or you pay taxes longer. That's where Social Security comes in, to where that person would claim on themselves for Medicare because they had the 10 work years, but they claim on their spouse for Social Security because they would get a higher benefit, claiming on 50% of their spouse's benefit would be greater than 100% of their benefit. So, and we'll do a webinar on Social Security here in the next couple of weeks too, just to kind of give some information on that. Now, in the past, they've always had Social Security numbers. Now, in April of 2018, they're taking away the Social Security numbers, and they're giving everyone a randomly assigned number, which you see on the screen here. Now, if you've already got a card, you'll get a new card with a randomly assigned number sometime between April of 2018 and April of 2019. And they'll get a new card. Now, every card printed April of 2018 and beyond, they will automatically get, like the person I mentioned earlier turning 65 in October and their card was printed in July, there's going to be a randomly assigned number. Now, one thing I always warn people or warn my clients on is watch out for scams. We live in a scam-happy world, and people are making hundreds of thousands of dollars, millions of dollars in some situations, and their whole goal, their whole job in life is scamming other individuals. And unfortunately, the people that they want to scam mostly is seniors. And so just warn your seniors that Medicare or Social Security will never call them on the phone uninvited. And if a person ever calls them and says they're from Medicare or from Social Security, it's a scam. They're not from Medicare, not from Social Security. I got a phone call yesterday myself that said that it was a phone call from the IRS that IRS was suing me. Well, obviously the IRS is not going to call me over the phone, and that was a scam. And so just make sure that you kind of warn your clients not to fall for the scams that we have. So when does my Medicare begin? If your birthday is between the 2nd and the 31st, your Medicare will go into effect on the 1st of your birth month. So, for example, if you're born on May 23rd, your effective date for Medicare will be May the 1st. If your birthday is on the 1st, your Medicare will go into effect on the 1st of the month prior to your birth month. So, for example, if you're born on May the 1st, your effective date would be April the 1st. And so now that's just for Medicare. Social Security, you become full retirement age a month early too if you're born on the 1st. So you get to take Social Security even a month early too. So now let's talk about Medicare Part A. Now, Medicare Part A is your hospital coverage, and Part A hospital has no premium. And as long as you paid Medicare taxes for at least 10 years, or you're married to someone for 10 years that paid Medicare taxes for 10 years, and there's different ways to. 99% of Americans pay zero for their Medicare Part A. I can't tell you the last time I ran into someone who pays something for Medicare Part A because they either worked 10 years or they were married to someone who worked 10 years, or they have a disability, or they low income. There's all kinds of different things, but the most common one is working 10 years, being married to someone for 10 years who worked for 10 years. But if you work for less than 10 years, or you didn't have the spouse who worked for 10 years, then you got 30 to 39 quarters. You would pay a Part A premium of $232, and then if you pay Medicare taxes for less than 30 quarters, you'd have a monthly premium of $422. Now, with Medicare Part A, there's a $1,340 deductible. So let's discuss that here for a second. Now, so Medicare Part A. So what if I go to the hospital? Now, this is for each benefit period in 2018, for each benefit period. So if you're hospitalized and then discharged and hospitalized again, that's a new benefit period. So for each benefit period, for days 1 through 60, all you pay is $1,340. Now, obviously, you and I both know there's a lot of Medicare plans that's going to pay all of these charges I'm talking about, but I'm just going to walk through if a person went on Medicare only and did not take out a Medicare Advantage plan or a Medicare supplement, this is how their Medicare would work, in which 99.9% of people don't do this. This would be a huge, huge, huge mistake for anyone to do this. But I do want to show you what these are called exposures of Medicare, the gaps that Medicare has, and then obviously you help them choose a Medicare Advantage plan or Medicare supplement plan to fill in those exposures and those gaps. So days 1 through 60 pay $1,340 deductible. That's it. Days 61 through 90 is $335 per day, and you kind of see down through there they would continue to pay. So a person has 150 days worth of coverage for each benefit period. Now, so Medicare Part A, Medicare Part A is your hospital, it's your confinement. So hospital confinement, also nursing home confinement. So what if a person went and stayed in a nursing home? Medicare is going to pay for the first 20 days, and then days 21 through 100, they would pay a fee there themselves, days 21 through 100, and then days 101 and beyond, they would pay all the cost. Now, on the Medicare, on the hospital, on the nursing home coverage here, this is Medicare only pays for the first 100 days. So I strongly encourage a person to take out a long-term care policy or have some type of a long-term care policy, a standalone long-term care, or a a life with a long-term care rider, and for example, Nationwide has one called Care Matters. Nationwide's product is absolutely a tremendous product in which it's a true long-term care rider on there. And so there's all kinds of different long-term care options that the person has. But everybody has a plan. Some people plan to use their savings, which, unless they've got a ton of savings, it wouldn't take long to use that in the long-term care years. Some people choose to have family take care of them, which, that probably is not a great option, but some people do choose that. Some people choose to spend down to Medicaid, which, it's not, you got to spend down to $2,000 worth of assets, and probably not the best option. And some people, they choose to purchase some type of long-term care plan, whether it be a standalone long-term care policy or some type of hybrid life long-term care rider policy. And those are becoming much, much, much more popular nowadays than ever before. So, but everybody has a plan. It's just, some of those, that person just didn't, chose not to develop a plan. Now, Part B medical. The Part B is your medical coverage, which includes your doctors, and you have a $183 deductible with Part B, and that's a once per calendar year. So let's just use that example. Earlier we talked about the person turning 65 in October, and their Medicare goes in effect October the 1st. Well, they would have that $183 in October, November, December, then it start again in January. It's a calendar year deductible, not a 12-month period. And the standard premium is $134 monthly, and that's a standard premium. Now, the reason I use the word standard is because you could pay more, could pay less, and I'll show you in the next slide. Now, if you're on Social Security, your Part B premium will be withheld from your Social Security check. If you're not on Social Security, you will receive a premium notice from Medicare to mail in your Part B premium. So if a person took Medicare, took Social Security at age 62, 63, 64, or is taking it at 65, then their Part B premium of $134 will just come directly up from their Social Security check. Now, this here is a chart that kind of shows you what a person's Part B premium is. And it always looks back 2 years. So if your yearly income in 2016 for what you paid, that determines what you pay in 2018. If your yearly income was $85,000 or less if you file individual, or $170,000 or less if you file joint, then your Part B premium would be $134, which that incorporates a large percentage of, in somewhere in the over 90% of Americans, that they fall in this category. Now, and less than 10% fall in the categories below that, but let's just say that you got a person who makes $200,000 a year between them and their spouse, and they file joint. Well, that would be the $187.50 premium for their Part B. So they would pay an extra premium for Part B because of the higher income. Now, here's one thing you can kind of help your people with. Hopefully, you're helping your clients with not only their Medicare, but hopefully you're helping them with their like annuities, whether it be a single premium immediate annuity, a deferred annuity, or some type of indexed annuity, a growth annuity, or whatever it may be. You're helping them with their annuities. And so we had a client, this has been a couple of years ago, that had some money with us, and he wanted to, at the time he retired, he wanted to take out some money. He took out, if memory serves me correctly, like $350,000 out of his savings plan that he had, his annuity he had done, and he took it out. Well, when he took it out, I warned him that he would get a higher Part B premium in a couple of years. And this has been 2 or 3 years ago. So let's just say 3 years ago, 2015. So in 2017, he paid a higher Part B premium because, he took that money out, and it was he had to pay taxes on a portion of that money, and so it put him up into the highest bracket on this form here. So, but it put him on the highest one. So anyway, long story short but he only had to pay the higher premium for 1 year. Then the next year it went right back to the lower premium. So let's talk about Medicare Part B. Medicare Part B is your medical coverage. Original Medicare pays 80%, and you pay 20%. It's real similar to the health insurance plans that people have had for years and years on their job or individually. For most of those plans are 80-20. So this is exactly what this is. So now let's talk about Part B excess charges. I only sell Plan G. I don't sell Plan F, and I don't sell Plan N or any of those other plans. And the reason is because I want my clients to have the Part B excess charges, and I'll get into at a later time why I don't sell Plan G, Plan F, because Plan F new sales are going to see starting January of 2020, and the rate increases on those will most likely be much higher than any other plan. Once they stop letting the 65-year-olds enroll in that plan, they're no longer letting the young people enroll in that plan. Everyone else in that plan is going to age, and you're going to see very large rate increases. So if you have anyone on a Plan F now that can help qualify to come to a Plan G, I would highly recommend that. And there is still a company that will allow you to go from F to G too on a guaranteed issue basis if you live in Missouri, for example, like the Missouri Anniversary Rule. But in most states, you have to health qualify to go from F to G. Now, let's talk about Part B excess charges. What this means is, let's say you go to a specialist doctor and they will not reduce the bill. They would take the money from Medicare, but they would charge full price. Okay, let me give you a perfect example. If you after the call, if you call down to MD Anderson in Houston, Texas, which is one of the largest cancer units or cancer centers in America, if you call down there and ask them, do you accept Medicare? Their exact response is, because I did this, because I had a client that's getting treatments down there now. If you call and their response is, we accept Medicare, we do not accept Medicare assignments. And what they're telling you is this: they'll take the money that Medicare is going to give them, but they're still going to charge 15% above what's called Medicare approved amounts. Medicare has a big book, and it's not really a book, but they have a set amount they're going to pay for each and every service that a client could have rendered. So let's just say a client has a chemo treatment, and let's just say that Medicare says that chemo treatment is going to be, the Medicare approved amount is $10,000. And obviously, you and I know a chemo treatment costs more than $10,000. I'm just using $10,000 for easy math. And so what MD Anderson is saying is that we're going to charge $11,500 for that chemo treatment, to where a doctor who accepts Medicare assignment would only charge $10,000. Because MD Anderson accepts Medicare, they just do not accept Medicare assignment. And MD Anderson is not the lone ranger. There's a lot of doctors and hospitals that don't accept Medicare assignments. They accept Medicare, but they're not going to accept Medicare, the Medicare assigned amount. And so what that means is they can charge 15% above the Medicare approved amounts, and that's the most they can charge. If you go with the Medicare Supplement Plan F or G, they're the only two plans that cover the Part B excess excess charges. They're the only two have the excess benefit. So that's one of the reasons I would only sell a Plan G is because of the excess benefit. I would not sell a Plan N unless the person absolutely wanted it, because I want my clients to have that Part B excess just in case they wanted to go somewhere that accepted Medicare but did not accept the Medicare assignment. So now this right here is, I'll walk through this real quick since we got just a few extra minutes here. The following amounts may increase in 2019. If your income and resources are slightly higher, you should still apply. Now, this is we talked about this a few weeks ago, but I'll kind of hit it again here. This is what they call the QMB, SLMB, or the QI program. These are the Medicare savings programs that give people extra help for Medicare prescription drug coverage and also helps them pay some of their Medicare expenses. And I'll kind of walk through these real fast. The first one is a qualified Medicare beneficiary, which is QMB. And you'll see the income limits there is $1,025. So these are for individuals with very low income. And then the married couple is $1,374. And then the resource limits. Resource limits is cash. It's not your homes, your automobiles, your personal belongings, your guns, your jewelry, et cetera. It's only cash. It's your savings, your checking account, your 401ks, your pension plans, your IRAs, your things of that nature, your CDs, et cetera. That's resource limits is your cash. And so if you qualify for the QMB, it'll pay your Part A premium. Your Part A premium is probably already paid anyway, but just in case it wasn't, it'll pay that. It'll pay your Part B premium, which was $134 monthly. It'll pay your deductibles, your co-insurance, and your co-payments. And so this person would probably be best off, not probably, they would be best off on a Medicare Advantage plan, because it's going to pay a lot of expenses for them being on the Medicare, the QMB, the Qualified Medicare Beneficiary. Now, there's another one called the SLMB, and you'll kind of see down through there what the numbers are. The incomes are a little greater than the QMB was on the previous slide, but this program will help pay for the Part B premium. And all the programs, if you remember on the first slide, all the programs help pay for prescription drug costs. So when you go to Medicare.gov and you enter all this information, it's going to be a lot. You'll see the drug discounts built into the Medicare.gov system, and you'll see in the top right-hand corner when you do the personalized search on Medicare.gov, you'll see if they're receiving extra help or not in the top right-hand corner. And then so here's another one called the QI program, and the QI program has higher limits, higher income limits, and also it pays a Part B premium and also pays helps them with the prescription drug coverage, gives them prescription drug coverage discounts. So we'll get into this next week, but for time's sake, we'll stop today. We'll get in next week talking about Medicare choices between original Medicare and the Medicare Advantage plan. What are the differences? And so we'll dive pretty deep into that and which plan's best and so forth. And there is no which plan's best. It's based on each particular individual situation, but we'll dive into that. Because a lot of times people say, which plan's the best? Well, it really depends on your situation and what you're looking for health care in your Medicare years. And I'll walk through both of them with them and let them make the choice. So is there any questions anyone has at all? Any questions at all? We appreciate you joining. This will be out there, and we're going to send out several attachments along with this, and that way we'll send out a Medicare fact finder. We'll send out the Medicare 2018 cost at a glance. We'll send out the Medicare supplement page that shows all the different plans because, again, the Part B excess, only F and G pay that, and the only difference between F and G is F pays a Part B deductible $183 once per calendar year, and Plan G does not. So we'll send out several things along with this. But if you ever have any questions about Medicare or any type of insurance, feel free to call me. I'd be glad to help you. And if you're one that ever wants to get involved in trying to do seminars or do Walmarts, get into anything at all, just call me. We'll brainstorm together. I can help you set up, get your lot set up to where you can really get going into Medicare if you choose to. Medicare is a great, great, great avenue to do it because most of the carriers pay 20% or more in comp each, on that, and it's a level comp for 6 years. And so, let's just say the average premium is, and I'll just use $100 a month. That's $1,200. If you're getting 20% of that, that's $240. So let's just say $250 commission that you're going to get. And let's say you sold 100 this year. Well, obviously that's $25,000. You sold 100 next year, and you keep those same 100. Now you're up to $50,000 income. You can kind of see how it doesn't take long to get to $100,000 worth of just renewal income, residual income coming in. It doesn't take long at all. So, have any questions? Feel free to call me, and hope you have a great day. Thanks, everyone.